So the lecture is being recorded now. I will teach you, I will teach this vitamin D from your, there's a very good picture in your Lippincott. Okay, so I will teach the conversion of vitamin D from Lippincott book. This is A. Okay. Okay, here we are. Now you see how vitamin D is converted. First of all, I will take you back to the first aid, and we will see I will that what they have written. The active form is this. Okay, 125. We call it 125 dihydrocholecalciferol. This is the complete name. Okay, or we can call it calcitriol. But this is the process of conversion begin from 25 hydroxy D3, okay, in the liver to the active form 125 dihydrocholecalciferol in kidney. So this line is, I'm gonna explain you from this picture. Okay, you see this is ultraviolet light. We all know that we say that we get vitamin D from sunlight. This is true. We get vitamin D from sunlight. So the ultraviolet light of your sun rays that is coming down on earth, okay, is get absorbed in our skin. This is our skin epithelium. Okay, there is a substance that is present in your skin already, which is called 7-dehydrocholesterol. This is a component in your skin. Okay, it is present already. What does ultraviolet light do? It converts this 7-dehydrocholesterol into cholecalciferol. Okay, ultraviolet light itself is not vitamin D. Clear your concepts. Sunlight does not contain vitamin D. Sunlight is only helping. Sunlight is only helping this 7-dehydrocholesterol to convert into cholecalciferol. Okay, sunlight do not contain vitamin D. Keep that thing in mind. Once this sunlight will convert this 7-dehydrocholesterol, a component in your skin, into cholecalciferol, this cholecalciferol from your skin will go to your liver. Okay, and in your liver, this cholecalciferol will be converted to 25 hydroxy cholecalciferol. Okay, cholecalciferol is basically D3. Cholecalciferol is D3. We just add a hydroxyl group at the 25th position. So if you have remember the basics of biochemistry or the organic chemistry, we have this long carbon chain, okay, and then we have positions like 1, 2, 3, 4, 5, 6, and so on, 25. So at the 25th position of carbon, we just attach one hydroxyl group and change the structure. When the structure of this D3, for suppose this is a backbone D3, and this is carbon number 25, and at the carbon number 25 we are attaching this hydroxyl group, we are doing hydroxylation at this point. This D3 will be converted to 25 hydroxy D3 in the liver. Then from the liver, this will go to the kidney, and in the kidney this will be converted into the active form. This is the active form of vitamin D. This is vitamin D. Okay, this is vitamin D. So you get sunlight, which was responsible to making it active. but you are not getting vitamin D from sunlight. These are two different concepts. Always remember this. Sunlight do not contain vitamin D. It is just uh, a catalyst, or it is just an enzyme, or say anything which is just helping. It's a helper. It is just helping or initiating the process, okay, and is converting this component present in your skin into cholecalciferol. So this pathway is important. You should remember the full name of vitamin D3, which is 1,2,5. Now this is converted into this. So at first we have this hydroxylate carbon number 25. Then we have this carbon number 1. And we attach another OH at this level. So now you have a hydroxyl group at the first carbon and at the 25 carbon. And this is your active vitamin D. This is your active vitamin D. This is 1,2,5-dihydroxycholecalciferol, which is vitamin D. We also call this calcitriol, okay, calcitriol. So mm, anything which has calcitriol. So when you see this OL at the end, that means that structure has a hydroxyl group. Okay, this is the basics of organic chemistry. Okay, you might have read these things in your intermediate. So I'm clearing this mess up. Then what happens? There are certain factors that inhibit and activate this process. For example, low phosphate in parathyroid hormone, which we call PTH in short. You will see PTH written in your first aid. Okay, so parathyroid hormone or low phosphate levels activate the conversion of 25 into 125. Okay, so they are making more and more vitamin D. But when you have more and more vitamin D activated form, it will give the signals that please don't make me more. Don't make me more. I am enough already. So this can itself inhibit its formation. So okay, I understand this. If this is in more quantity, it can itself inhibit its formation. But low phosphate and PTH can activate these things. This process. Okay, so you have this thyroid gland. These are two different glands. This is a parathyroid gland from which you are having parathyroid hormone. Okay, so in your thyroid gland are present like this. Okay, and along with it we are having the parathyroid gland. Okay, so the parathyroid gland is producing parathyroid hormone, and the thyroid is producing T3, T4, and calcitonin. So there are three hormones that your thyroid gland is releasing. So we are only talking about the calcitonin here. Okay, we are only talking about calcitonin. So now what will happen? This 125 dihydro uh, cholecalciferol, the active form of vitamin D, okay, it enters from the kidney. It enters from the kidney into the blood. It is in the blood, and from there it goes to the intestine. So it is traveling, all the organs. Now, from kidney it goes to the blood, and from the blood it comes here in the intestinal cell. This is an intestinal cell. Okay, and now at this level we have this process of gene expression. This is called gene expression. Okay, and what is gene expression? Gene expression is transcription and translation. Okay, like copying the message, okay, Transcripting means like copying the message and then translating it, which is the work of messenger RNA. Okay, so we have these RNAs for all those work. So we are doing this gene expression. So this should be the nucleus. Okay, and then the messenger RNA forms the protein, and that protein binds with calcium. We call it calcium calmodulin. There are many things that are not written here. Definitely when you will be studying patho and physio, you will be learning a lot more details of it. So it binds to that, okay? It becomes activated, this becomes activated, and then this calcium from your gut, from your gut that you're intaking as in food also, is going to blood. Okay, this calcium binding protein, calcium calmodulin, is activating this process of calcium, and then this calcium is going and storing in your bone. So what is the role of vitamin D in the storage of calcium? Now, when a person, when an old woman who has osteoporosis, the doctors give her vitamin D to drink. You have vials. We call in hospital, we call these vials. These are tiny bottles, okay, which has this liquid in it, and it is vitamin D. You have to just break it and you have to just pour it in glass. You can mix it in water or you can mix it in milk, and you have to drink it. So it has vitamin D. It is you can drink vitamin D as well. Okay, so we give these old women who has osteoporosis or arthritis to who has low levels of vitamin D, and then what will it will do? It is like pre-synthesized, right? This whole process will not be occurring. Ye, this whole process will not be occurring. You are just drinking it, so you are directly getting that synthesized form of vitamin D in your gut. Okay, you are getting that synthesized form of vitamin D in your gut. So you are just what you're just doing, you're just it is directly helping your calcium to get stored in your bone as osteo in the formation of your osteoblasts. You have two terminologies, osteoblasts and osteoclasts, okay? Osteoclasts are the destructive ones, okay? And osteoblasts are the forming ones. So blast is forming, okay? So it gets deposited in your osteoblast. So this is one function. This is like pre-synthesized a drug, and this is like natural. So the natural vitamin D is doing this process in storing of calcium, okay? And what else? It may go inside, or it may directly from the blood, it may directly activate this process also. Okay, then another thing is this calcitonin, which is coming from the thyroid hormone, is inhibiting this process. This is very important. Okay, you will be studying many diseases in your pathology endocrinology portion. So calcitonin is inhibiting this process of calcium uh, excretion from your bone to your gut lining to into your blood, okay, for the absorption purposes. So let me clear this thing. So I think we should go back to our book, and then you see this parathyroid hormone, which is also activating this calcium process. So let's go back to our book, first aid. So now I'll quickly read this. Okay. So you see D3 cholecalciferol from exposure of sun. I just told you this is stratum bacilli is a lining of your skin. We have 5 layers of skin. Okay, so one of them is stratum basale. So at that stratum basale, so at that level, your skin gets exposure to the sunlight, and this process all starts. To sun, ingestion of fish. Now there are other things also that you are eating. and by eating you're giving vitamin D. For example, we have this in fish, D3 in fish and in milk and in plants also. Okay, then D2, which is called ergocholecalciferol, from ingestion of plants, yeasts, and fungi. Okay, both of D3 and D2 are converted to 25 and in the liver. Okay, just remember this picture. Both of them are converting into this liver, D3, D2. They have to be converted to this 25 in the liver, and then this process in the kidney goes on. Okay, and to the active form 125 dihydroxycholecalciferol in the kidney. So I think you got this part now. Okay, so let's move to its function. Increase intestinal absorption of calcium and phosphate, as I have shown you in the picture. Okay, so the calcium was being absorbed from this intestinal cell. Okay, it increases this absorption of calcium from your gut, which passes to your intestinal cell, where your active form of vitamin D 1 to 5, I'm only writing 1 to 5. Okay, this is activating this process, and then it's going into the blood and then being stored into your bone. Okay, increase bone mineralization at low levels. So you see, uh, again, from your blood, it is helping it move into your bone. Okay, and increase bone resorption. What do you mean by bone resorption? Bone resorption means the calcium is being stored in your osteoblast. It is helping your bone to maintain its integrity and shape back again, that we call resorption. That is from that osteoporosis. In an osteoporostic bone, you will see osteoclasts in lots of number. Okay, but in a bone resorption process, the osteoclast turnover will be less than osteoblast. Okay, osteoblasts will be more. So bone resorption is like uh, uh, going back to the formation of a proper bone. Okay, resolving osteoporosis thing. Okay, so if we give low levels of vitamin D3, it will only increase bone mineralization, that is only storage. But at high level, it will also uh, recover that osteoporotic situation. Okay, so regulation. Now this part is important to understand. There are a lot of MCQs that have been asked in your biochemistry and also in your um, endocrine physiology too. So you should know this at this particular level. The people forget these arrows, so you have to kind of remember. They forget what is increasing, what is decreasing. Okay, so I just showed you in the picture. Pictures are easier to remember. Okay, so PTH is activating the formation in the kidney. Okay, and PTH is helping take out this calcium from your bone. Okay, and so you see, more PTH, increased PTH, more 125. But on the contrary, you have decreased calcium and decreased phosphate. They are decreased. Why? Because this 125 activates the process of calcium binding. Okay, it activates the process of calcium binding, and then it lets that calcium out into the blood and then to the bone. So if you have more and more 125, it will self inhibit this process. Okay, so when you will have low levels of calcium and low levels of phosphate, then only your parathyroid hormone will work, and they will be like, okay, now it's my duty to perform these actions. So these are the triggers. Okay, so remember that decreased calcium and decreased phosphate is a trigger to increase parathyroid hormone release, and then parathyroid hormone will ultimately increase your 125. This is like a summary, so they have written it in one line, but the triggers are calcium and phosphate. They should be decreased, so they will give these signals, and parathyroid hormone will be increased, and then that parathyroid hormone will activate this 25 hydroxy into 125 hydroxy. Okay, so remember this thing. It is important. Then you have this 125 hydroxy D3 I showed you, that is doing the feedback inhibition. This is doing feedback inhibition to its own production. I'm talking about this active form. Okay, this active form 125 is doing this feedback inhibition to its own production, because it is produced in more quantity. It is saying, I don't want to be produced more, please stop my production. So it is causing its, this is called feedback inhibition or self inhibition. Okay, so you understand this point and you understand this point. If you are not understanding any point, please tell me. Okay, I will repeat it. So now increase PTH, more and more PTH is being released from parathyroid gland. So it will, what it will do, so now you see this is the same step. It will increase, because the triggers were decreased calcium and decreased phosphate. They will give the signals to parathyroid gland, we want more parathyroid hormone. More parathyroid hormone was secreted from this parathyroid gland. It will subsequently increase the calcium and the phosphate, increase the calcium reabsorption, okay, from the blood, okay, and it will decrease the phosphate reabsorption in the kidney, because in the kidney, when phosphate will decrease, you will be forming more vitamin D. Okay, you see, low phosphate is a trigger to the formation of more vitamin D, and parathyroid hormone is also a trigger to form more vitamin D. But this parathyroid hormone is a trigger for more and more calcium reabsorption as well. From the calcium will, it will bring the calcium from the bone into the blood. Okay, so this is what your parathyroid hormone is doing here. Okay, and this is what your parathyroid hormone is doing here. So these are two different mechanisms. So you have to understand this. In your first aid, they have summarized this whole thing into just 3 lines. So if you grabbed the concept of these 3 lines, you will not forget it. Okay, so the triggers were calcium and phosphate. They give the signal to parathyroid gland. They increase the PTH secretion. The PTH will increase the calcium reabsorption and decrease the phosphate reabsorption. And both of these things will subsequently increase the formation of 25 hydroxycalciferol into the 125 hydroxycalciferol, which is the active form of vitamin D. So I think I'm clear at this point. Okay. Now we have the major part, which is deficiency. Okay. In deficiency, rickets. You see bowed legs in children. Okay. Rickets in children and osteoporosis in adults, or you can say osteomalacia in adults. Okay. Deformity such as genu varum. We have two terminologies. One is genu varum, varum, okay, and the other one is genu valgum, okay, valgum. So genu varum is like this. Your legs will be bowed. So the knee portion will be outward. That is genu varum. But genu valgum is like this. The knee portion will be inward. Okay, so remember, I remember it by gum. Gum is sticky, so it's like a gum, it's like sticking together, and varum is pushing outward. So remember, this is genu varum, bowed legs in children, and it is because of less calcium deposition in the bone. Okay, when a baby is born, the doctors prescribe to take them into sunlight, so that avoid the condition of rickets. Okay, and osteomalacia in adults, bone pain and muscle weakness. Hypocalcemic technique, this is a very important concept. Hypocalcemic technique, the calcium in your muscle spindles, okay, is not is secreted more from your sarcoplasmic reticulum. When the calcium from your in your the muscle spindle that has a sarcoplasmic reticulum, calcium is stored in sarcoplasmic reticulum. Okay, that calcium is released more release of calcium causes hypocalcemic tetany. Tetany is like a claw type of hand. I may show you a picture of tetany. You see this hand. This is tetany. Okay, this is tetany. So calcium plays a big role in your tetany. This is such a bad picture, but I'm kind of explaining you the mechanism of tetany, that the calcium from your sarcoplasmic reticulum is too much into your is too much out from your sarcoplasmic reticulum, and it is causing the muscle contraction process. I will explain you in physiology after we will be done with neurophysiology, the muscle physiology. Okay, in that I will explain you the whole mechanism. It's a huge full mechanism, so it will take another class. Okay, so remember hypocalcemic tetany deficiency. They do ask an MCQs. Caused by malabsorption. Okay, many people think that the muscles become flaccid. Okay, so that is wrong. The muscles are not becoming flaccid. They are having tetany because of low calcium in the blood and more calcium in your muscles. Okay, for the contraction in your cells of the muscles. Caused by malabsorption, decreased sun exposure, poor diet, chronic kidney disease, very important MCQ, chronic kidney disease, okay, and advanced liver disease. Because you see, the cholecalciferol D3 was converting into 25 in the liver, and this 25 was converting into 125 in your kidney. So if you will be having your kidney disease or a liver disease, So you will not be activating this vitamin D, okay, and you will see the deficiency in those patients. So remember these two. Give oral vitamin D to breastfed infants. You can give it to breastfed infants as well. Oral, I told you vitamin D is given oral, okay, and deficiency is exacerbated by pigmented skin and premature birth, because your metabolism is not well performed. So premature birth can cause it, and also pigmented skin, because the melanin does not let the ultraviolet absorb to your stratum basale. So the pigmented skin can also, okay. So you see these problems in Africans more. Then you have excess hypercalcemia. Definitely, if you'll take more and more vitamin D, more and more process will occur, more and more calcium will be in your blood. So hypercalcemia, more calcium in blood. Hypercalciuria, subsequently you will be excreting more, so more calcium in your urine. Okay, loss of appetite, stupor, seen in granulomatous diseases. Okay, so I told you kidney is the main organ, okay, and increased activation of vitamin D by epithelioid macrophages. So it's like you have to remember these two things in access. Okay, so this is our last um, these are our last minutes of our lecture also, and we have completed vitamin D. Okay, so um, the little time we have, let me show you the Lipin card. So in Lippincott, vitamin D is a big, huge topic. They have explained all those processes here. Okay, they have told you that we got ergocalciferol from plants and choline from the animal tissues and from the diet. Okay, and then we have this vitamin precursor, which was dehydrocholecalciferol in your skin, from where the process starts. Okay, and then you have this metabolism, complete metabolism that I showed you in the picture with all these, enzymes and all these things. But at your level of license exams, you don't need to learn that much detail. Okay, this is basic. Lippincott is a basic book. Okay, then this again very deep, and then you have these functions. So everything is same, so nothing is different. Clinical indications are important, so you should know them. So they have explained rickets in here, and even the dosages and everything. But you don't need to get in that. Okay, and then renal osteodystrophy, as I told you, in adults, it's osteomalacia, we call it, and chronic renal failure also results in this because it's been activated in there. And hypoparathyroidism, obviously, parathyroid hormone is playing its major role. So if you will be like having hypoparathyroidism, what will happen? Your calcium levels will be low and your phosphate levels will increase. So everything will go opposite. Okay, and then toxicity, excess, important it is. So because it can be stored in the body, so you can show these symptoms. Okay, so that's all, people. Like um, you can go through your major textbooks for understanding if you're still having problems. So this is all, this pathway is the same. Increase parathyroid will increase 125, okay? And then this parathyroid will increase calcium mobilization from the bone. It will push it out from the bone and will increase the renal reabsorption of the calcium into the intestine, okay? And the renal excretion of calcium will be decreased. The calcium absorption from the intestine will be increased, and the plasma calcium will rise. So this is a loop. This is a loop. Okay, so we have finished our lecture today here on vitamin C and vitamin D from your first aid book, and tomorrow we will be learning vitamin E and vitamin K. Okay, So if you have any problems in both of these, you can ask questions later. We have like 4 minutes left. So if you have any questions, you can ask, or else I'll end this class and we will have our next class of pharmacology maybe, or anatomy. I will tell you in the group uh, at 7:15. Okay, our next class. So do you have any questions? If you people have no questions, we can end our lecture. Okay, because we are done with today's topic, and we are only left with 3 minutes. So this recording will automatically end after 3 minutes. So if you have any questions, I can answer you in 3 minutes. Okay, Maria. Rock says both legs only in middle-aged people. No, 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 no. Both legs are not in middle-aged people, man. It's in children. So don't mix that concept. Is osteomalacia is the osteoclastic activity that is going on inside the bone, but you will see these bowed legs always in the patients of rickets. Okay, in the patients of rickets, bowed legs. Also, bowed legs, genu varum, genu valgum, they are pediatric problems. They are not adult problems. Okay. Any more questions? So we are like ending our lecture because no questions are here. So I will be online at 7:15, okay, for the pharmacology. And yesterday we studied muscarinic antagonist. So today we will be studying the synthesis of norepinephrine and epinephrine, okay, and we will be moving to the adrenergic agonist drug from first aid, okay. Thank you so much.